Hi, my name is Elani Diaz.
Vincent Armstrong.
Lana Rondo.
Jack Kirkpatrick.
Justin Fennell.
Tad Terry.
And I'm Kelly Richard, and we did our project on Carpathia Collaborative.
The ship that rescued survivors of the vanquished Titanic inspired the design of Carpathia Collaborative, an integrated functional medicine practice located in Dallas, Texas. Current conventional healthcare is compared to the historic Titanic tragedy, stating, lots of modern technology, but focusing only on the tip of the iceberg when it comes to the addressing underlying causes of disastrous health epidemics in our country. The fundamental goal defined by Dr. Margaret Christensen, MD, and Heidi Irakbal, MD, co-founders, is to provide a safe passage to those who climb aboard. The mission set forth by Carpathia Collaborative pivots on a foundation of functional medicine, fulfilling a compassionate 360-degree science-based approach to health. The Carpathia team is comprised of over a dozen multidisciplinary health professionals that collaborate under the premise of an integrative, holistic care model. Patient education and involvement is prioritized throughout care, focusing on the underlying cause of illness, moving beyond disease to build resilience, vitality, and well-being.
Carpathia Collaborative Center focuses on treating, prevention, and cause of chronic conditions such as Hashimoto, diabetes, sleeping disorders, anxiety, weight management, hormone balance, and chronic pain. Their team is composed of professionals just like MD, naturopathic doctor, physical therapists, nurses, yoga instructors, dietitians, and psychologists. They have the latest technology in health modalities, such as infrared sauna, which helps for detoxifying the body from heavy metals and plastic, hyperbaric chain chamber, which helps bring in more oxygen to the injured tissue for faster healing, and also they also have ozone therapy, which is great for ear infections, sinus infections, and flu. Their main focus is to help the women that are passing through menopausic changes, infertilities, and fibromyalgia.
What sets Carpathia Collaborative apart from other integrated practices is in their name, their collaboration. On a weekly basis, the medical professionals will come together to talk about some of their more complicated cases. These meetings consist of a presentation of the patient, their history, results of tests that have been ran, and interventions that have been used to this point. After the presentation of each patient, the floor will be opened for further testing, additional treatments going forward, or even for others to comment about the patient's demeanor on their last visit. Everyone's thoughts are valued with respect and the acknowledgement that their suggestions come from a place of education, experience, and an overwhelming desire to benefit the patient. In the healthcare goal of do no harm, Carpathia Collaborative has an impeccable approach through their humble collaboration amongst professionals.
Carpathia differs in its approach as a cash-only practice while providing their clients with everything necessary to file with their insurance. The uniqueness in the specific individual services they offer affords them the opportunity to have a cash-only business. Insurance is utilized for lab work, advanced labs, and prescribed medications. The physician can provide the ICD-10 and CPT codes for filing out-of-network benefits called a super bill, although this does not guarantee a reimbursement. Layla Doolittle, a Parker University chiropractic graduate, charges $395 for a 90-minute visit, $295 for a 1-hour follow-up. The medical physician established client visit is $425, osteopathic $295, family nurse practitioner $225, acupuncture for $100. The estimated daily income for established patient ranges from $100,000 to $120,000.
Because Carpathia Collaborative is so unique and valuable in the services that they offer, it allows them to also be unique in the way that they charge for their services. The chiropractor in the office, Dr. Doolittle, bases her charges off of the amount of time she sees her patients. To review again, she makes $395 for an hour and a half on the first visit, and for normal visits, it's $295 an hour. We calculated what a typical chiropractor in the area would make, and compared it to Dr. Doolittle's numbers. To do this, we considered 5-minute appointments at $60 a patient, which comes out to $720 an hour. If you add a 50% overhead, then it comes out to $360 an hour, which is about $60 more an hour than Dr. Doolittle. That would be considering that she takes home 100% of the profits, which we're not sure about.
Carpathia Collaborative is unique in its approach to combine collaborative healthcare along with functional medicine. When we searched to see if there are any competitors or any clinics doing the same things that Carpathia is doing in the Dallas area, we searched first the functional medicine side, and there were 39 other clinics doing functional medicine in the Dallas area. Then we searched collaborative healthcare in the Dallas area, and there were 6 other clinics. And then when we combined the two and searched collaborative healthcare and functional medicine, Carpathia had only one competitor in the Dallas area. The one competitor was a lone practitioner under one roof, just practicing functional medicine. So Carpathia is actually the only clinic in Dallas that has a multitude of doctors under one roof, as well as facilities and multiple health modalities that really sets them apart in this area as a collaborative functional medicine facility.
All right, so with any successful business, there's always room for improvement. A few recommendations that we thought of that Carpathia could improve upon included their marketing strategies. So for example, their social media presence could be better. Their Facebook could have more followers. They could get an Instagram account or a Twitter account just to reach a broader audience. They could also start a blog, which would make a more personal connection with their patients and spread information out there more. High impact marketing strategies like billboards, TV commercials, radio commercials would also help with just impacting more the Dallas-Fort Worth area. Other recommendations include expanding their hours outside of the 9 to 5 weekday, and so working parents, people in school, anyone else that would limit scheduling problems and just be more patient-centered. They could examine cutting costs. So with any business, they might not realize where costs have accumulated, so examining their budget and making cuts where it's necessary, that would help them succeed more. Lastly, their weekly collaborative could be a bi-weekly collaborative. So instead of having one meeting at the end of the week, they could have one at the beginning, one at the end, so they can talk about what's going to happen for the week and just improve their efficiency.